Okay, I think we could get started. So if you want to go to the next slide. So, okay, welcome everyone to the Community Health Needs Assessment overview. And here's a quick brief review of our agenda for today. So I'm going to introduce you to Maricopa Public Health staff. We're going to do a quick overview, review the survey results, and then go over addressing any of the community health needs assessment priorities, and then have a brief discussion afterwards if we have enough time available. So to start, my name is Judith Ramos, and I am the Public Health Liaison for the Southeast region of Maricopa County. And I'll go over specifically the cities that it covers a little bit into our slideshow. But I have two co-hosts with me today. I have Annie Demuth, and she is the Community Health Needs Assessment or Supervisor, and Jessica Francis, who's also Community Health Needs Assessment Coordinator. And they're both here today to review in more detail the aspects of the Community Health Needs Assessment, why it's important, and why we have this assessment every 3 years. So moving forward. Okay, so here are our objectives. So following this presentations, we're going to look at doing a brief overview, like I said, and review the survey results. But we're also going to spend some time describing the entire community health needs assessment process and the impact it has on our community. We are also going to identify all of the findings by region and by city in your respective areas. So even though it's a regional overview, we do have some more detailed information about some of the cities that participated in the Southeast region. We also are going to have access and share with you the programming, the policies, and the grant writing that we went through to get some of the items that we utilized, how it was set up, the policies we had to follow in terms of how we presented the survey and how we gathered the information. It's very important. And then you will be able to see your regional and city profiles individually. And those are going to be available to you after the presentation. We're also going to ask you to participate in addressing the community health needs assessment priorities through the community health improvement plan. And actually, Annie and Jessica will discuss that in more detail, and then how you can support our upcoming 2026 community health needs assessment cycle. Did we just lose our presentation?
I'm rebooting it. Please give me one moment.
All right, I can talk about that. And I know that 2026 sounds like a really far away, but it's not. I mean, I was just blown today that we're already in October 2024. So these things come around quickly. And here at Maricopa Public Health, we want to be efficient. We want to be respectful of everyone's times. We'd like to have a plan in place that is solid so that we can commit to times and address your your need for the information as soon as possible. And we are very thankful for your patience this year in waiting for these results, because we did do that. We performed the surveys last year, very successful, and I'm just so excited about what we've done here in the Southeast region. So I'll tell you a little bit about myself. So like I said, I'm the Southeast Public Health Liaison. I have a master's in public administration from Arizona State University and combined experience of 19 years of local and county government experience. My strengths have always been in program development and the implementation of programs and community engagement and empowerment. So coming here to Maricopa County to be able to bring those gifts to the community has been just a tremendous opportunity for me. I love engaging with the community. I really enjoyed this process in the community health needs assessment and getting your input and feedback on the surveys. I also currently serve on the board of the Salvation Army because I also strive to just make a difference in my own personal community and to help those around me so that their voices can also be heard. So we are now on the Southeast Public Health Liaison slide, which is the next one, I believe. Whenever you get to it.
Apologies. Let me try sharing again here.
No, I really appreciate it. We did put a lot of work into getting this together, but we've been having some technical issues and not always on our end. So I'm going to go over some quick housekeeping items. Basically, we're going to ask you to save your questions till the end or put them in the chat as we go through if you're thinking about them, and then we will respond to them when we have a mini break. And then also once we're done with everything, we're going to ask you to complete an evaluation survey at the end of the webinar to see how we could have made this presentation a little bit more engaging for you, or if you loved it, we want to hear that as well. And also you're going to receive a recording of this webinar, and then the slides we're going to share them with you in about 3 to 4 weeks following this presentation. And of course the webinar is being recorded, just to let everybody here know. So moving forward, and move one more, and then I just went over that. And the next one. So I promised I'd let you know what the Southeast region is for public health. And I basically interact with the cities of Apache Junction, Chandler, Gilbert, Guadalupe, Mesa, Queen Creek, Tempe, and briefly with Sun Lakes. And the population in this area is pretty dense. I calculated about 1.3 million is what we have currently, give or take. So it's approximate. And Phoenix alone is, I think, a little bit greater than that, but still, we're really like have a huge population here in the east, in the Southeast region. So our input, or your input on this survey was incredibly helpful because we got a good range of folks that are, you know, we got a good, what is it, not range, but we received a good indicator of the issues that are actually occurring in the Southeast Valley. So with that, we have a little video that is coming up, and it's to give an overview of the CHNA process. And this video was one that we showed early on in the process. So when I met with many of you early on, I probably sent you the video, or we both sat down and viewed the video together so that you could be aware of what it is that we're gonna do. So with that, I'll play this. It's a quick 1-minute video. So Annie, can you hit it? Thank you.
What does health look like in your community? Join us as we explore the health and well-being of residents of Maricopa County through our upcoming Community Health Needs Assessment Survey, launching in March 2023. Maricopa County Department of Public Health strives to create a healthy, thriving Maricopa County for all by listening to what's important to the community and engaging people in meaningful ways. To do this, we collaborate with healthcare systems and community partners to conduct a community health needs assessment, also known as a CHNA, every 3 years. By working with community partners, we have increased the level of resident input we collect over the last 10 years. When more residents reflecting the diversity of Maricopa County take the survey, we can better identify and address the issues that people in our community care the most about. What has CHNA data shown us so far? For the last CHNA, we conducted 2 community surveys, one standard survey in 2019 and a supplemental survey in 2021 about the impacts of the COVID-19 pandemic. Across these 2 surveys, the community identified the following priority areas. These top priority areas also emerged in stories shared by the community. Here's one story shared by a community member regarding their physical and mental health impact.
So where does this data go after it's collected? The CHNA data has sparked action to accomplish the following. Share data with at least 7 major hospitals and healthcare providers to inform new approaches to serve the community. Center community voices to inform decision-making for program and policy development. Direct funding to local community organizations to address top community needs such as mental health, access to care, and social determinants of health. And inform the CHIP developed by over 100 community partners who form the Health Improvement Partnership of Maricopa County. The CHIP is a long-term systemic effort to address health needs based on results from the CHNA. What else can promote well-being and health equity? We look to community members to tell us in the upcoming CHNA launching in March 2023. As a leader in Maricopa County, your partnership is key to that success. Our collective efforts to promote the survey among our networks, both virtually and in person, will help ensure that we capture the most representative community data. We hope that our collaboration will provide strong opportunities for Maricopa County residents to achieve lifelong health. Visit maricopahealthmatters.org to explore past survey results, complete the CHNA interest form, and become a CHNA champion today.
Thank you. So the next slide. So this year, as part of your participation, not only were we able to meet our department goals, but we were able to actually exceed our goals, especially in special populations. In early 2023 was when we made the call out for everyone to step up and have some community engagement. And with the support of many partners in the Southeast Valley and several events that we attended, such as the Employee Network or community events like, I think it was Extravaganza, and just a number of them. We collected over 18,000 surveys. And this was a really great representation because we haven't in our past, we had not always been able to get a good diversity of the Maricopa County. So we didn't have a good feel on that. So this was an incredible participation. And we also, just as a side step, we also provided a COVID, in the middle of COVID, we provided another survey. But again, this particular survey that we did was very, very well responded to. And we have a really great representation now. So see, these are some of the numbers that we are able to collect from some of our priority populations and per the public health region of the county. So you can see that in the Southeast, we had 4,805 that represented the Southeast region. And utilizing this approach, so we're able to have a really good sample of the county's population. And we actually are able to tailor our outreach and identify the needs in each region, in particular, looking forward to 2026. So these are what we call our city profiles that are available. And one of the requirements to really to have a profile that is really representative of each city is that we request at least 250 responses from city residents. And we obtain them through a variety of events, even if we were in the city of Mesa, but someone from the city of Chandler was attending this event. Chandler would still be counted as a Chandler resident. So just so that you're aware, all these surveys were actually representative of the individual. And we were able to gather enough responses from Chandler, Gilbert, Mesa, and Tempe. And this year, we'd like to welcome Queen Creek because they were actually able to acquire the 250 needed responses to actually have a profile for their own. So yay to Queen Creek, you guys did a great job. And I'm hoping that this year will even increase the number or in the 2026. So next. So here is an example of the ones, the cities that weren't able to make it in the Southeast. It's Guadalupe had 69 and Apache Junction 38. In both these situations, it did not have anything to do with your city not being active or not wanting to support or provide or be a portion of it. It's that Guadalupe is also a portion of Tempe. And so some refer to you as Tempe, not living in Guadalupe. And in Apache Junction, the area was so small that even if we'd gotten everybody in that area, you still wouldn't have reached the 250 that are required. So we could talk about that some more, but this is why you did not receive any a profile for your city. But that doesn't mean that you still can't request certain information from us. It's just that your representation is so small that it really will not indicate a good value for you and whatever it is that the information that you're looking for. But I can work with both of your cities and see how we can work together and get you the information you need. So part of this process is really, we want to recognize the partners that made this possible. So within your individual cities, we had public schools that participated, nonprofit organizations. We had events at community centers. We worked with our faith-based organizations, mental health, hospitals. All of these partners came together to help us expand the diversity of the community. So this year, so in this particular one, we were able to offer also grants to some of the nonprofits, which we may or may not be able to in the following years. But they were able to focus on certain special population groups that we were not able to do in the past. And we also had a request for 23 community-based organizations to be funded. And that's how we got a wider representation this year. Also, we had the university students from ASU also provide assistance to us in the applied epidemiology class. And they worked with the city of Phoenix on that. For example, some of the partners that we worked with, I mean, there's just so many, but Cancer Support Community Arizona, Flipdart, Family Tree Healthcare, and these are just to name a few. There were so many. The Tempe Community Council all provided assistance in this process. So some of our keys to success, but overall, you were the keys to our success. So when I reached out to you and asked, could you support us? Could you provide examples of events that we could attend? You made that possible for us. And you opened our eyes to opportunities that we didn't have before. This year, this next segment of the 2026 survey that we have, I'm probably going to be reaching out to you a lot earlier so we can get plugged into those events earlier. But I appreciate so many of you when I called and it was kind of a quick turnaround or last minute that you were able to accommodate us. It really meant a lot to me and it meant a lot to your community as well. And again, any ideas that you have for us coming up, just, make a note of it or send me an email and let me know. So we can get started on that. So you all did a great job, and that's all I have to say, but you were primarily our key to success. And here's some pictures from the event, different areas. Next. So for our data collection events overall, so this is the entire community health needs assessment. It took us 18 weeks of data collection. And I kept asking, why can't we extend it? Well, there are requirements for the CHNA and how long we can actually survey the community. So there are some parameters that we had to work under, and 18 weeks of data collection, I believe, was the limit. We had 187 community events in total, 1,300 plus hours at events. And that was just an incredible amount of hours. And I felt like I was out there every weekend, but I really enjoyed myself, enjoyed meeting your community members. And then we also had 68 staff plus volunteers. And these volunteers are part of the Maricopa County Reserve Corps. And they were so helpful at these events. They went out and helped us acquire more surveys. We also provided some giveaways like safety kits, I think a salad kit, summer kit, and a snack kit. And I don't know if I'm missing any more, but that was provided through some additional funds that we had access to. I don't know if we're going to have access to those again, but it was 4,500 giveaway kits that we had. And now I'm going to introduce Annie, and you're going to go through the survey results in more detail. And then she's going to share with you how you can have access to that as well. So thank you for your time, and I'll be coming back towards the end of this presentation. So there'll be more. Annie, it's all you.
Thanks, Judy. Can you hear me okay?
Yes.
Awesome. Yes, as Judy mentioned, this effort to collect such representative data was so hugely due to the support of our community partners. And as Judy mentioned, she was out in the community every week, every weekend at events and such. And so we're so excited to be able to share not only the results of the county of the Southeast region, but of the 5 different cities that we have profiles for in your region. So this next section, the purpose of it is to equip y'all to access and share public health, community health data for use in programming, policies, and grant writing. So throughout the next section, I'll be explaining some background of the data, and Jessica will be also dropping some links in so that you have access to these data sources. So the first thing I want to talk about is our growth over the years. So in 2012, we conducted our first CHNA survey in English and Spanish and paper format and collected almost 1,000 results. As years went on, we added additional features and modalities. So for example, in 2017, provided some small grants to community partners to help with outreach. In 2019, we added a virtual format and a regional approach for engaging populations to make sure that we were getting a variety of responses across the county. 2021, as a result of the COVID pandemic, we did a survey that was virtual only. and included about 12 different languages for the survey to be provided in. And then the most recent data collection, 2023, we had paper and virtual survey options, 14 different languages, a regional approach where we set specific targets for not only our different geographies, but also our different demographics to make sure that the data we have reflects the diversity of the county. And yeah, received over 18,000 responses. So some of the data that we collect as part of the community health needs assessment, one of the pieces that we're going to be focused on the most today is the community survey. So it is a survey of a handful of questions that we typically have answers that people can, check all that apply, or sometimes they can fill in their own options. We monitored recruitment goals, and it was really designed with that accessibility focus, multiple languages, large print. We also were able to have our CARES team, which is our group of public health folks who navigates phone calls and referrals, to be able to conduct the survey over telephone for folks who wanted to do it verbally. So the survey helps us kind of get the most amount of data across the largest amount of people. Focus groups really help to understand a little bit more in depth what people are going through. So we hosted over 40 focus groups. They were in person and virtual, really with that focused population approach. So we had groups focused on youth, on seniors, on LGBTQ individuals, on refugee, immigrant, migrant, and to really better understand folks' experiences and solutions for improving health. And then key informant interviews. We interviewed over 20 leaders across different sectors. So education, health, community organizing, et cetera, to get a better understanding of our infrastructure and what can be used to improve access to health through these infrastructural pieces. So we're not going to be going too much into focus group or key informant interviews today. You can scan this QR code to read those reports yourself. We'll also have that dropped in the chat. And I just did want to do another reminder that if you have certain questions, you'll have the opportunity to, in your chat box, you can select down, and I believe you can either select Jessica, Francis, or myself to submit your question. We're collecting those, and then we'll get to them at the end. All right, so before we dive into the fun stuff, I want to just level set on how we're going to be interpreting this data. So whether you work with numbers all the time or you're new to it, hopefully this is helpful just to get us in the right headspace to understand what do these survey results mean for our community. So the format that you're going to see as we move forward in these slides, as well as if you're to take a look at the profiles that we've published by county, region, and city. At the top, you'll see the survey question. For example, this survey question was, how would you rate your physical health? And the answers, optional, were good, fair, and poor. So this first section here that says 8% overall, that is the percent of all respondents who took the survey who reported poor physical health. So that means that of everybody who took the survey, 8% said that they had poor physical health. So next is when we want to kind of look deeper into how does that poor physical health differ between, different demographic groups of people. So for example, we asked folks who took the survey to identify their race, ethnicity, age, gender, income, and if they identify with the focus population. So if you can imagine all the different optional responses from those, there's probably 40 or 50 different categories, because we can say, these 7 or 8 races, these, 6 age groups, these different genders. And so we look across all the data in those different groupings and we say, okay, among which of those groups did people report the highest level, or did the most people report poor physical health? And then those are the groups that we really show on the screen. So for example, we had 28% of individuals who took the survey that identified as disabled. 28% of them reported poor physical health. Of unhoused folks who took the survey, 22% reported poor physical health, and 15% of those with income less than 15K. So another way to think about this is that over 1 in 4 disabled respondents and 1 in 5 unhoused respondents reported poor physical health, compared to 1 in 12 overall respondents. And an example interpretation could be, disabled and unhoused respondents report the highest rates of poor health and may benefit from additional support and resources. So hopefully this gives some kind of helpful background of what we mean as we're showing these slides. All right, let's get into your results. So this QR code will take you to the profile for the Southeast region. We do have 3-page profiles for each of our different regions. We also have a very big survey report that has all the different questions that we asked broken down by demographics. So if you love tables and you really want to dive deep, we'll also be putting the link to that survey in down the road. Awesome. All right, so when we look at the number of people who live in the Southeast who took the survey, we had 4,805. Huge number of folks who live in the Southeast that took the survey. This is the demographics that we show on the profile, and they're all compared to national measures, so like the US Census. I do want to say that this year we collected much more in-depth demographic data than we have in the past. So for example, we included Hispanic Latino instead of a separate ethnicity. We got a lot of feedback from community members that that could be something that could just be included as an overall race ethnicity. So that was captured differently than the US Census. We also included an option for Middle Eastern North African. You're not going to see that here because that is not a US Census category that we have data on. But if you look into the more in-depth report, we have that specified out. We also have more options for gender and sexual orientation. But again, because male and female is really the only gender identity that is captured on the US Census, for this profile, that's all we're showing. But check out our more in-depth reports to get really more details about our expansive gender categories. As we look at this, the population in the light blue demonstrates the percentage of people in the Southeast region who identify with the specific demographic. So 2% of people living in the Southeast region are American Indian or Alaskan Native. Out of all the people who took the survey in the Southeast region, 8% were American Indian or Alaskan Native. So what that means is that we were able to reach, with our community's help, to outreach to a higher proportion of our American Indian, Asian, Black or African American, and Native Hawaiian or Pacific Islander residents, a higher proportion than you would have expected based on just the overall population proportion. What that means is that we have higher numbers to look at these different, the responses of these different groups and have really more information about how they're affected and their health and by their health and environment. So similarly, we have age under 18 years old. You'll see that only 3% of the folks who took the survey were under 18, compared to 23% of the population. That's because we only surveyed to people from 12 to 18, so we do not have any infants or elementary school children taking the survey. So that's why we're going to see that category underrepresented. And as is fairly typical with surveying practices, we had a much lower representation from male individuals and a higher representation from female. So that is always a group that we're working to get more engagement from men in the community. All right, let's talk about health impacts. So the question, which health issues have the most impact on you and or the people you live with or care for? We're going to compare county results to regional results. And for this first one, they line up really closely. Across the county, everyone who took the survey identified anxiety, depression, high blood pressure, chronic pain, and diabetes as the top 5 issues. We had about 15 different health issues listed, and people could write in their own. Southeast region, the same exact top 5 in the same exact order. And we do kind of see this across the board, that these are really the top issues that are affecting people by county, by region. And you'll notice too, I don't have any markers here that show any cities. So that means that each of those 5 cities that we have profiles for also had these issues in their top 5. Now, they might have been in slightly different orders. A couple cities have maybe high blood pressure listed number 1 or diabetes listed number 2, but these are still the top 5 across the board. Now we start to see a little bit of difference. So the question, how would you rate the following assets in your community? These are the assets that are top rated as poor. So both the county and the Southeast region identified access to affordable housing, access to quality public transportation, and ability to communicate with local leadership and feel my voice is heard as the worst ranked assets in their community. However, when we look at the cities that we have profiles for, Tempe listed feeling safe while driving as a low ranked asset in their community. Mesa identified access to quality and affordable childcare as a low ranked asset. And Queen Creek identified access to programs and activities for seniors 65 plus as a low ranked asset. So you kind of start to see some of the differences here by city as what residents are looking for and would like to see improved. When we look at what assets are rated as very good in the community, between Maricopa County and the Southeast region, access to parks and green spaces and feeling safe in your home are both in the top 3 like highest rated assets. However, the Southeast region, instead of the opportunity to participate in religious, spiritual, cultural events, lists access to public libraries, community centers, and educational events as higher in those top rated assets. When we look at our cities, Mesa and Tempe both identify opportunity to participate in religious, spiritual, or cultural events in the top 3, and Gilbert and Queen Creek identify access to safe walking or biking paths in the top 3. So I'm curious, as you're looking at this data, if this resonates with kind of your experience, or if there's anything that's surprising you. So noodle on that as we move through. So when we asked, how would you rate your physical health? Very good, fair, or poor. We saw that across the Maricopa County and the Southeast region, that the same 3 groups had the highest rated poor health. Those who were disabled, unhoused, and those with income less than 15K. So remembering a little bit earlier, I was explaining that for these different items, we compare all of the different demographics. So many categories of race, ethnicity, age, and gender. So we're looking at 40 to 50 different groups that we're comparing what percentage of each of those groups rated their health as poor or very good. So as you can imagine, as we look at that per each city, there's a lot of different options that come up. So we're not going to be going into the city by city differences here. We are going to refer you to check out your city profiles on the website. And you are going to see that as far as your groups that list poor physical health, there are going to be different subcategories. So you're going to have specific ethnicities, specific income levels or genders that say that they have, that are more likely to report poor physical health in your city. When we look at how would you rate your mental health, we had poor mental health was identified by 10% of respondents in the county and 11% of respondents in the Southeast region. We had unhoused and LGBTQ+, those were highest categories of folks in both the county and the region. But one difference is that in the Southeast region, folks with disabilities were more likely to rate their mental health as poor versus in the county, those aged 12 to 18 were in the top 3 for rating poor mental health. And again, you can look at your specific city profile to see which of your populations kind of rose to the top for poor mental health. We asked, how often can you get medical care when needed? Sometime, and these are the respondents that said they can only sometimes or never get care when needed. Once again, we have our county and Southeast region top populations kind of rise up. So for Southeast region, 69% of people who identify as Native Hawaiian or Pacific Islander who took the survey said they can only sometimes or never get care when needed, followed by those unhoused and refugee immigrant migrants. That's 1 in 2 refugee immigrant migrants who said they could only sometimes or never get care when needed. And then how often could you get mental health care when needed? We had 1 in 5 individuals in the county and in the Southeast region only sometimes or never get mental health care when needed. Native Hawaiian Pacific Islander, refugee immigrant migrant or the populations that rated the highest difficulty in getting mental health care. It's 80% of our Native Hawaiian or Pacific Islander communities. One difference, though, is that while at the county level, Asian population demonstrated the highest difficulty in getting mental health care. In the Southeast region, the unhoused population identified the highest difficulty. And again, as I've been mentioning, it differs city by city, so you can take a look at your city to see which populations demonstrate the highest difficulty in getting mental health care. So this is our last data point before we wrap up today. We're going to get into a couple quotes and stories, but we find this to be a very helpful question. So what would help you get the care you need? And we asked this question of everybody. Even if somebody responded to the survey and said they always get care when needed, we know that there's oftentimes aspects that can make getting care easier. So in the county and in the Southeast region, evening or weekend appointments and lower out-of-pocket costs for services were the top two things that could help get better access to care. However, countywide, folks identified more appointments available as like that third option, whereas in the Southeast region, multiple services at the same location was a more popular option for helping people get care. When we look at the cities, those in Mesa and Chandler did identify having more appointments available, and those in Queen Creek said that having services closer to where I live would be among the top three facilitators to getting needed care. So definitely helpful to kind of see that distribution in regions and cities. All right, we know that a lot of you all have been doing work on substance use, and we're interested in getting a little bit more information about substance use in the community. So we pulled a few quotes that were from our countywide focus groups, and then some quotes that were from your region directly. So these quotes are all there's one from the low-income youth focus group, Native American focus group, and just a general youth focus group. Just talking about on one of these quotes, the one to the left says, folks don't always have therapists available to help them work through mental health issues. That's what possesses them to harm someone or do something stupid or go into drugs because of that lack of education. We need better resources to understand our emotions. The one to the top right from our Native American youth focus group are just really talk about kind of struggling with identity and like getting into the influence of drugs that we shouldn't be using at this age, just because maybe folks aren't really paying attention. And the last one talks about substance abuse in schools, and there should be greater attention to the fact that kids are having these problems, and they should push forward resources to put them on the right path instead of punishment. So those are some of the quotes and stories from overall county level youth. And then here's some from the Southeast region. So we had, of the 18,000 people who took the survey, about 4,000 filled out our final question, which was, what else would you like to share about your health and the health of your community? So we're doing kind of a preliminary analysis of that data. So these are some sneak peeks of those quotes. We do intend to share those out in the spring more widely. But from Mesa, somebody said, more services in addiction, please. From Tempe, drugs are too prevalent on a street level with open usage in open and public spaces. And from Chandler, some more information of Alcoholics Anonymous and other meetings, and if there's transportation available for their meetings. I'm a recovering addict, alcohol person, and sometimes having no way to make any meetings because of lack of funds. If I'm able to find some kind of assistance to the meetings, I'd love it to ensure my sobriety. So just a sneak peek on a couple voices from your area. All right, so we've talked about quite a bit of data, but there's much more online. So here's some different resources for you. You can scan the QR code or go to the link maricopahealthmatters.org. You can download survey profiles for the county, your region, and your city if it met that 250 mark. And soon we're going to be posting some more profiles on special populations. So we have LGBTQ, seniors, Native American, and some of those other focus population reports that'll be coming out. You can look at focus group, key informant interviews, the community survey, and if there's information you're still interested in learning more about, you can submit a data request, and our epidemiology team will take a look at that and see what additional information we can provide. You're always welcome to connect with us, Maricopa Health Matters at maricopa.gov, if you want, to understand something better or to see what other information there is for you to access. But we don't want to stop with just identifying the issues. We want to make next steps to improve community health. So this next section, really the purpose is to really encourage our participants today to participate in addressing CHOP priorities through the Community Health Improvement Plan and support the upcoming 2026 CHNA cycle. So every 3 years, we do a CHIP or Community Health Improvement Plan. It's a requirement from our Public Health Accreditation Board, and the purpose is to set priorities and target resources to really do actions based on what we found as top issues in the community. So we did a many-month-long process of assessing community data, population data, getting input from various community-led committees, and came out with these 5 priorities: mental health, access to healthcare, access to healthy food, substance use, and housing homelessness as the issues that we really want to address in the upcoming improvement plan. So we'd love to extend an invitation for you to help be a part of our subcommittee meetings, which are defining what is that problem that we want to address in each of these big topics. So there's one on October 9th that has already passed. There's one tomorrow from 12 to 2 p.m., one on November 20th from 12 to 2. And then on December 4th, we're going to have our quarterly partner meeting. It's always a good time, lots of networking, there's lunch, and to be able to share out what these subcommittees have really determined as far as next steps. So Jessica, if you don't mind you can either scan the QR codes or we'll put those links to register to those subcommittee meetings in the chat. They're virtual subcommittee meetings. You're not committing to a 3-year commitment if you want to attend. We just want more people to be able to weigh in on when we talk about addressing mental health, what do we mean? What's that going to include? And if you're interested in being more involved in the Community Health Improvement Plan work, you can check out hipmc.org, contact the team at hipmc@maricopa.gov, and subscribe to newsletters. These newsletters are amazing. There's always neat photos, little highlights telling you what meetings are coming up. So definitely recommend subscribing to the newsletter if you can. All right, so we have got through all of our content. We have about 10 minutes left, and I wanted to pass it back to Judy to kind of facilitate a conversation if we got any questions through the chat, and to also take some time to get your feedback through an evaluation. All right, Judy, I've asked to unmute. Are you able to?
Yes, very good. Okay, thank you. So as Annie said, with this, I would like to actually facilitate a conversation. If you have any questions, even like how to utilize the data, how this could help you, this is your opportunity to really ask any specific questions, and Annie and Jessica will answer any questions that are specific to data. So does anybody have anything? And I don't have access to see the questions. So Annie and Jessica, do you have those? That'd be great.
Yeah, so I don't think we've received any questions so far. If you have one, again, you can drop that into the chat to myself or Jessica. So I'll just give folks a minute.
And then also remember that this data, if you have like community development reports, if you are trying to access grants, that this data is available to you. And also if you have questions about a specific zip code in your area, you can also contact us for that information. And or if you need any specific area that maybe wasn't addressed in the in your results, maybe we can work with you to, not maybe, but we will work with you to get you that, that information. So if anybody else has anything else, I'd love it. And also make sure you look on your chat, because Jessica's providing some great links for you. And also I really encourage you to attend at least one of the meetings to see how you know, the CHIP, or the Community Health Improvement Plan, is developed for our entire community, and this is for all Maricopa County. So did any questions come in? No. Okay, so with that, I'm gonna ask all of you to complete the evaluations. If you can get this QR code, and that's just for us to make these presentations more valuable in the future. So I want to thank Annie and Jessica, because this was really a collaborative effort, and we wanted to make this this presentation, you know, valuable to you. And also, you know, if you have any specific concerns, like I said, about your zip codes, you can also reach out to me and or Annie or Jessica, and we can try to get that data for you for that specific area. And I can also send you some invitations to attend the CHIP for those dates that that Annie provided, to see if you can make any of those. And I hope you found this information helpful. And again, I'm going to be reaching out to all of you early in the year or next year, so we can have everything ready to go, and we can continue to have like more representation and more participation in your cities. So with that, I think that's it.
All right, well, that's wonderful. Thank you so much, Judy. Thank you everyone for attending. We'll be sending out this evaluation link too, because at the end of it, we have all these good links to resources. But yeah, thank you all for joining us. I think are we good wrapping 5 minutes early?